on and on and on. Let me just make one other point. I'll save you. For 30 years, we've had a federal law that says that we're not going to have taxpayer funding of abortions. We've had this debate in the House. It was a very serious debate. But in the House spoke. And the House upheld the language we've had in law for 30 years, that there will be no taxpayer funding of abortions. This bill that we have before us, and there was no reference to that issue in your outline, Mr. President, begins for the first time in 30 years, allows for the taxpayer funding of abortions. So, Mr. President, what we've been saying for a long time is let's scrap the bill. Let's start with a clean sheet of paper on those things that we can agree on. Let's take a step-by-step approach that'll bring down the cost of health insurance in America, because if we bring down the cost of health insurance, we can expand access. Mr. President, I told you the day after, maybe it was the day you were sworn in as president, that I would never say anything outside of the room that I wouldn't say inside the room. I've been patient. I've listened to the debate that's gone on here. But why can't we agree on those insurance reforms that we've talked about? Why can't we come to an agreement on purchasing across state lines? Why can't we do something about the biggest cost driver, which is medical malpractice and the defensive medicine that doctors practice? Let's start with a clean sheet of paper, and we can actually get somewhere, and we can get it into law here in the next several months.
John, you know, the challenge I have here, and this has happened periodically, is every so often we have a pretty good conversation trying to get on some specifics, and then we go back to, you know, the standard talking points that Democrats and Republicans have had for the last year. And that doesn't drive us to an agreement on issues. There's so many things that you just said that people on this side would profoundly disagree with. And I would have to say, you know, based on my analysis, just aren't true, that I think the conversation would start bogging down pretty quick. Now, we were trying to focus on the deficit issue. And the fact of the matter is, as we indicated before, that according to the Congressional Budget Office, this would reduce the deficit. Paul has different ideas about it. Other folks may think that there are better ways of doing it. But right now what we're doing is focusing on the issue of federal entitlements and whether we can make some changes. I will come back to you, I think, at the end of this session to answer a range of the questions that you just asked. Right now, what I want to do is go to Jim Cooper,